So, can you talk a bit about seroma, please? Causes, cures, etc. So, yeah, seroma is fluid collection, and it's not blood. It's wound fluids. It's watery yellow fluid which collects in any time, um, anytime you have a surgery with a space. And the common areas are, well, for cosmetic surgery, I guess it's a tummy tuck is a common area. For sort of breast reconstruction, which is the other sort of thing that I do, is used to do really. I don't do so much reconstruction these days, but it's in the back where you take a big muscle from the back, the lat dorsal. You take a big muscle and leaves a space. And anytime you have a space, that space can fill up with wound fluid, and that's a seroma. And so causes is just the fact that there's a space, there's a raw surface because you've cut, as I say, you have to undermine it when you do a tummy tuck. When you do a tummy tuck, you have to undermine it to close it. When you do the lat side, there's a space because you've removed the muscle because you've used the muscle to reconstruct the breast. So you've got a space where that muscle used to be. So anytime there's big spaces, there's sort of raw surfaces, and those raw surfaces can ooze wound fluid, which is the serous fluid, and that ooze can collect and form a seroma. And as the seroma collects, the, the, the two wound sort of surfaces can't close. It can't heal up. So it's a bit of a self-fulfilling prophecy, really. That's why it's good to have it. If it's dry and it sticks together, then it's stuck. But once you get a bit of a seroma, then it's like it can't stick then. And so sometimes you have to, you don't always have to drain it. It will get better on its own. It will reabsorb on its own if it's not a big one. But if it is a big one, you often have to put a needle in and drain it. The problem is when you drain it, you leave a space there and then it can come back again. It usually does come back again, but it usually comes back less. And so you have to sometimes repeatedly drain them. Each time you drain them, there's a risk of introducing infection. So you don't want to drain them too often, but at the same time, you don't want to leave people with sloshing about fluid all over the place, which is uncomfortable and which is going to take ages to get better. So if it's a big one, you have to drain it. So that's the cure. That's the cause. The cure is really just to drain it and then compression as well. So if it's the tummy tuck, then either the garment, if you've been given a garment, or big pants, the big pants, like the figure hugging pants, those can help just a bit of compression to help sort of close down that space. And as I say, there's things we do like the drains and the quilting sutures and glue. These are things we do in theatre to try and close down that space. But obviously that's not helpful for once you've got one. It doesn't really cure. That's more for prevention, I guess, than cure. So curing is just time. They usually get better on their own, and if they're big ones, draining it. They used to do things like inject stuff in to encourage the thing to stick down, but we don't do that anymore. So we just, well, I don't think many people do that anymore. We just usually just drain it. Um, Sarah, I should be on this morning. Thank you, Sarah. Yep, available. Talk to my agent. Available for this morning and other television slots. I haven't got an agent. You just Facebook me. Thank you. Um, so following on, this is following on here. Um, would you kindly add helping an oh this no okay. Would you add helping in edema reduce while you discuss seroma this evening, please? Also, how to effectively suntan after surgery without hurting the scar. I'm worried about my upcoming holiday. Tummy will be fine because bikini will cover it, but belly button and back knee scars are a little problematic. Okay, so we'll do the edema thing. How do you do edema while addressing seroma? So that's a distinct thing, edema and seroma. So a seroma is where you have a space. As I say, tummy tuck is the classic, and the space fills with fluid. Edema is swelling, is soft tissue swelling. So when you bang your arm, when you fall off your bike and you bang your arm swells up, and that's soft. That's tissue swelling. That is not seroma. It's like when you have your breast done. It's all like out there. That's not seroma. Seroma is free fluid you can put a needle in and drain off. You can't put a needle in and drain if someone's got a swelling. You've got soft tissue swelling because it's just in the tissues. It's not free. It's not watery free fluid. It's just all the tissues are waterlogged sort of thing. So edema is different to seroma. And edema happens after any surgery, and it's just sort of a generalized soft tissue swelling. Seroma, you can often feel the slosh of the water as you move. It sloshes about. It's like literally water sloshing around. Edema, you don't have that. It's just generally swollen. Everything feels, with your face or your toe after liposuction or whatever. So, so what's the question? How do you reduce edema? So basically, again, it's compression. It's trying to take it easy. but at the same time, you don't want to give yourself DVTs and slow down and give yourself chest infections and all these sorts of things. So I encourage you to mobilize and move. There's always a balance. You don't want to overdo it. You know, if you overdo it, you will make it swell more and you'll make the edema worse. But at the same time, if you don't move and get out and about, you will, or you know, your healing will take longer. You'll feel miserable, and you're more likely to get DVTs and things. So I think the balance is along the side of getting up and about and moving around. But if you feel that it hurts more, if you feel that it swells up more, then take it easy. Listen to your body, and it's your body saying you're doing too much. So listen to your body, and if you find your body swelling up, then or whatever your body part of your body is, then take it easy. And compression is the other thing for edema. So again, if it is tummy, you compression pants or the binder. If it is breast, then a supportive bra, and if it is another part of the body, just some kind of compression, like the compression hugging tops that rugby players wear. You know, so if it's a gynecomastia or something like that, so compression is good. I'm worried about hurting the scar. So this patient has had a tummy tuck. She's also had some excess tissue removed from behind the knee. So I totally get. Now I think the scars have faded pretty well, to be honest with you. So I think the main thing about the scar is while the red is red and obvious, you mustn't get a tan on it. Now, as you say, it's easy to cover the bikini one, or it's easier to cover the bikini one, but the belly button one is the problem. We try and hide the belly button one within the belly, inside the belly button. So it's often not on the front. So it's sort of in the shadows. Try and make it sort of in the shadows. So hopefully it's not too badly affected by the sun. And I think your scars have settled pretty well. I think they're sort of skin colored, are they? If they're not, if they're still a bit red, the scars, then yeah, you have to just wear like a swimsuit. You know, you shouldn't get a tan on it if it is red. And certainly, if you can sort of see it from the front, then you shouldn't get a tan on that skin. So yeah, you're absolutely right. You have got to be a bit careful about that belly button scar. But as I say, try and hide it on the inner part of the belly button, and also once it's faded, you can do what you want. But if it hasn't faded, if it's still quite red, then you shouldn't get a tan on that bit of scar. And also the same thing about behind your knees. They've faded. I think no, actually, maybe one of them's still a bit red. But anyway, the good thing about behind your knees is that sort of scar's hidden. It's in the sort of darkness. It's in the shadows. So I don't think that'll be too bad. But I would just be a bit aware of it and just don't lie on your front for a long time and get a scar on that. Maybe put a towel over the back of your knees. But yeah, just be a bit careful with these scars while they're red and obvious, which is the first 3 to 6 months, can take longer. So you've got to be careful with all this. And yeah, if you have still got some red scars, don't get a tan on them while they're red, because you'll lose the scar. You'll use the tan, and the scar will stay red. So that is a good question, and it is something that you need to be aware of and just protect them. And once they're faded, you can do what you want. You get a tan on them, no problem. But until then, just be a bit aware of it and try and modify what you wear and how you cover yourself. And have a lovely time, because it's going to be a great holiday. Lucky you. Look at the rest of us stuck here in all this weather. So that was a good one, wasn't it? Fantastic bit of engagement there. So thank you all for that. I'm out. I'm going to declare myself out of questions. And yeah, I'm going to check myself out. If there's no other questions in the area, I don't know if anyone's still around really. 8:30 at night, Thursday night. Don't know what you think of Thursday night. I only did it because I normally do it on Tuesday, but it was away on Tuesday night, so I don't know. Can do it Thursday night if you want, but anyway, probably go back to Tuesday just to keep a bit of consistency.